Hi, everybody. This is Andrew from Group 3 presenting on behalf of myself and Stephen. We will be presenting on the topic of tuberculosis. Hope you enjoy and find it informative. Tuberculosis is an infectious disease caused by bacterial infection of the lungs. Tuberculosis is derived from the Latin word tuberculum, which means small swelling, ultimately referring to the tubercles that form in the lungs resulting from an infection. According to the World Health Organization, about 10 million cases of TB occur every year, killing about 1.5 million people that contract it. TB most often occurs in the infected patient's lungs, but the bacteria can establish itself in other parts of the body, either as the initial infection itself or as a secondary spread deriving from an already active disease. The exposure to and potential development of TB can stem from several factors, including environmental, habitual, and genetic, that each require active monitoring and prevention tactics to minimize its adverse health effects on individuals, especially those living in more vulnerable communities. The risk for TB infection exists in all areas of the world, with some areas subject to greater levels of risk than others. Although it is a treatable disease, TB that is left unattended can very easily become fatal, making it the 13th leading cause of death around the world and the second highest killer in terms of infectious disease. Such a high-ranking illness demands the utmost importance of understanding TB and its nature. Therefore, this review of TB aims to further examine this infectious disease, encapsulating its pathology, necessary trends, and the most effective prevention methods to work towards managing its extent. The disease-causing agents of tuberculosis are bacteria of the Mycobacterium tuberculosis complex, of which the most common is Mycobacterium tuberculosis. Other pathogens in this genus that can cause TB are Mycobacterium candidii, Microti africanum, and bovis. However, these bacterial agents are considerably rarer as causes for TB infection and disease, making Mycobacterium tuberculosis the primary focus of TB research. Mycobacterium tuberculosis is a highly adaptive and highly contagious pathogen that kickstarts the development of granulomas or tuberculomas in the lungs as part of the immune response to exposure. M. tuberculosis resides within these granulomas after being introduced into the host system. In patients that have an overall healthy immune system, M. tuberculosis is most often kept at bay and not able to wreak havoc on the host, leaving the bacteria in a dormant state in the body. In patients that are otherwise immunosuppressed in any way, such as those with an active HIV infection or suffer from severe malnutrition, M. tuberculosis has a greater chance of contributing to the transition into active disease and cause adverse health conditions on the host. There is growing evidence that M. tuberculosis also has association with other human diseases, such as pulmonary diseases, autoimmune diseases, and metabolic diseases. As its name suggests, however, TB is the main condition resulting from M. tuberculosis infection. When it comes to TB, the primary mode of transmission for this bacteria is as droplets in the air released when someone speaks, coughs, or sneezes. There is also evidence of M. tuberculosis presence and permanence in natural and indoor environments, suggesting the possibility of recirculation of the infectious agent into the air for further reuptake by individuals. This would also represent an under-researched area of TB exposure data. Nevertheless, person-to-person spread is understood to be the main source of TB transmission in humans, of which its consequences have been the most closely observed. Tuberculosis can be broken down into two categories: TB infection and TB disease. TB infection, also known as dormant or latent TB, is the period during which an individual has the bacteria in their body but is asymptomatic and incapable of spreading it to others. These individuals have the potential to develop TB over time and are often prescribed medication to prevent further progression, especially if they have any kind of negative predisposition such as HIV infection. TB disease, also known as active TB, refers to the onset of the disease itself and includes a variety of mild to severe symptoms and the ability to spread to others. Following the introduction of Mycobacterium tuberculosis into the body, innate and acquired immune responses ensue, sparking the generation of tuberculomas in the lungs. As tuberculomas begin to form, the immune system's capabilities are truly tested in how effective they can encapsulate and control the bacterial agent, generally measured by how hardened or solidified the tuberculomas themselves are. If enough viable bacteria leak into the airways, symptoms will follow along with the ability to further transmit the bacteria, and the patient is now considered to have active TB. Some of the most common symptoms generally associated with tuberculosis are an overall feeling of sickness, weakness, weight loss, fever, and night sweats. Since the bacteria often nest within the lungs of its victims, prolonged coughing, chest pain, and coughing up blood can also be frequent with TB disease. Although much less common, TB infection can also begin in other parts of the body, such as in the central nervous system or in the kidneys, or it can spread to these areas as a secondary infection due to an existing case of TB disease. Occurrence of TB anywhere outside of the lungs is referred to extrapulmonary tuberculosis, and in turn can yield additional symptoms depending on the location of the disease in the body. Prevention and intervention for tuberculosis focuses on early detection, treatment, and prevention for all TB patients. It aims to ensure that all TB patients not only have equal, unhindered access to affordable services, but also to encourage healthcare workers to actively engage in their care. There is currently only one vaccine for TB, which is the BCG vaccine, used in many countries around the world that have a higher prevalence of TB. It is often administered shortly after birth to help prevent TB in children. There are two common tests available to identify TB in a host, the skin test and the QFTG test. The skin test is a skin puncture to test if any reaction will develop 2 to 3 days later following the puncture. The QFTG test is a blood test aimed at measuring how a patient's system will react to introduction to the bacteria that causes tuberculosis. The World Health Organization has also identified 3 components for prevention and intervention of TB, which is early diagnosis, treatment of all patients with TB, and vaccination against TB. Since TB is so highly contagious, health professionals also aim to follow up with those that may have been in close proximity to someone with active TB. Tuberculosis is largely known as a social disease with medical implications. TB infection is largely determined by how infectious the source of the disease is, such as the closeness and length of time of contact around an infected individual, along with the social and behavioral factors such as smoking, excessive drinking, indoor air pollution, and areas of overcrowding. Factors that can increase the likelihood of contracting TB are often found in impoverished communities that also have high levels of malnutrition, poor air quality, and high levels of tobacco usage. These factors contribute to the reputation of TB being a disease of poverty, since it often surrounds communities with poorer living conditions. These factors are often supplemented by limited access to healthcare, higher burden of HIV risk, and lowered nutrition and immunity. Tuberculosis can occur in all parts of the world, in people of all ages, and in both sexes. While this does hold true, about 95% of cases and deaths from TB take place in developing countries, with a substantial portion falling into what the World Health Organization considers the 30 high TB burden countries. In 2020, 8 countries accounted for about 2/3 of all new cases of TB, with India in the lead, followed by China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, and South Africa. TB rates are significantly higher in men than in women, which is reflected by a male to female ratio for worldwide case notifications of about 1.7. In addition, the risk of exposure and the subsequent infection varies based on individual risk factors, with racial and ethnic minorities having been disproportionately affected by TB disease. As an example, the TB rate in California among Asians and Pacific Islanders is about 19 times higher than among whites, while rates among blacks and Hispanics are 4 to 5 times higher. As the leading hotspot for TB, India recorded 2.64 million cases and about 450,000 deaths in 2019 alone. Much of this stems from an underfunded public health system that exists in the country, with only about 1.5% of their GDP allocated towards health. The private health sector in India is also highly underregulated, often making it a priority in terms of healthcare. India also has a very high rate of malnutrition, which in turn leads to higher immunosuppression and a higher likelihood of developing TB disease following an infection. This has been an ongoing issue in India and was exacerbated even further following the 2020 coronavirus pandemic that pushed more people into poorer living conditions following economic collapse. Experts suggest that an increased efforts in providing food rations could help ameliorate malnutrition downstream, but factors such as socioeconomic inequities, pollution, and poor housing infrastructure in the country contribute to this high rate of malnutrition in the first place and need to be addressed to have a larger impact in minimizing the spread and progression of TB. In closing, tuberculosis remains a pressing public health issue due to its virulent nature and harsher effects on some of the more vulnerable communities around the world. In understanding its pathology, transmission, and trends of its incidence, the most effective preventative measures can be established to have the biggest impact where it is needed the most. To achieve elimination of TB, ongoing efforts are needed to address the disparities that exist in communities across the world by developing programs designed to identify the underlying causes, as well as promoting education to awareness about the disease. There is a greater potential to work towards improving the overall health of everybody, especially when it comes to something like tuberculosis. Thank you for tuning into our presentation. We hope you enjoyed it and found it informative. Have a good evening.